Hi, I'm Bonnie. I'm currently working as a nurse practitioner. I have a variety of experience in both pediatric and adult specialties and have worked in mostly surgical services. So in January 2016, I woke up with anterior hip pain on the left leg. I didn't know what it was. I'm a very physically active person and nothing had been bothering me the day before, and there was no traumatic injury that I could recall. I play ice hockey, I swim, I do yoga, and I've been doing those things for years, so there was no new activity. I also was riding my bike uphill to work, 3.5, 4 miles a day in San Francisco, and the hills are pretty steep. I was in pain going to work uphill, and I was in near tears and would have to take my left leg out of the pedal and coast and try to pedal with only my right leg. I could barely walk to the bathroom in my own home. I had to limit my work hours because I couldn't, sitting was painful. The 90-degree angle in the hip was really painful. So I went to the orthopedist and he's like, you have FAI, it's classic, you play ice hockey. He's like, you're gonna need surgery. He's like, we can do physical therapy. If you go back to hockey, you will need surgery. It was kind of definite, like it was written in stone. My orthopedist did also, in the interim, order an MRI of my hips. There was a ton of inflammation surrounding like the femoral head and in the soft tissue. And it looked to be in the bone as well. So with that knowledge, I went forward and my husband found Upright Health on his search for a place for me to go to rehabilitate my hip. So my injury was in January of 2016, and I started coming to Upright Health in February of 2016. And again, not knowing if I was buying into this immediately, but going very open-minded because I couldn't even walk around my own small home. The first visit, there was a lot of muscular stretching and some muscular release done. And slowly over time, we built up getting into like exercises that were actually weight bearing. In the beginning, I couldn't even go up and down stairs, but after a few sessions, I was able to at least do that. I would say I was back on my bike, riding to work in about a month after starting, maybe 3 weeks. As far as ice hockey, I was actually back on the ice in about 2 months. It might have been 10 weeks at the most. When you've had an injury like that, you don't want to go out and do something that's going to re-injure. But I just kept getting better and stronger and faster. I try to share my experience with other people who have hip impingement to try to show them there are other options and that should be exhausted entirely first because the surgical outcomes are just not that good. So now I am as active as I can be. I have no pain during any of my exercises. I have no pain walking up and down stairs. I feel stronger than ever and have more flexibility and mobility than ever. Pain sucks, life shouldn't.